Welcome to the Read, Talk, Grow podcast, where we explore health topics through books. Our topic today is integrative medicine, and our book is Heal Faster, Unlock Your Body's Rapid Recovery Reflex by Dr. Victoria Maizes. I'm Dr. Denise Millstine, your host and founder of Read, Talk, Grow. I practice women's health, internal medicine, and integrative medicine at Mayo Clinic, and this will be our last episode as I'm transitioning to a new role focused entirely in integrative medicine at the University of Arizona, where I will work with my guest, Dr. Victoria Maizes, who is an internationally recognized leader in integrative medicine and the founding executive director of the Andrew Weil Center for Integrative Medicine at the University of Arizona. She's a professor of medicine, family and community medicine, and public health, and has been instrumental in transforming integrative medicine education worldwide. Dr. Maizes' most recent book is Heal Faster. She's also the host of the Body of Wonder podcast, where she starts each episode in a very specific way. So, hi, Victoria.
Hi, Denise.
It's so wonderful to have you on Read, Talk, Grow. Welcome to the show. For our listeners, Heal Faster, Unlock Your Body's Rapid Recovery Reflex is a collection of science-backed health topics informed by Dr. Maizes' 40 years of medical experience in the field that will be our focus and our topic today, that is integrative medicine. Victoria, tell us your inspiration for writing this book.
Well, first, I'm so happy to be on your podcast, Denise. I'm a big fan of you and of the podcast, so thank you. The inspiration, we both see patients who want integrative medicine, but we also know that there are many people out there who would love to be able to access it. They can't find someone, they can't afford to see someone. And so I really wanted to make all of this information accessible to people who maybe couldn't get an integrative medicine consult.
I love the way you answered that question, because this is a lot of why I create this podcast, which is available publicly, and perhaps why you also create Body of Wonder, because you want to make this information freely in the hands of anybody who could use it. How did you envision people reading the book? Did you think people would mostly sit down and read it cover to cover, or read the beginning and then think, oh, I have questions about digestive health and jump to that chapter? How are you thinking people would consume the book?
Yeah, well, I think many people will open the chapter that most concerns them. As you said, there is a chapter on digestive health. There's one that focuses on anxiety. There's one that looks at depression. There are many different longstanding conditions like diabetes and heart disease. There's a section on both preparing for and recovering more quickly and easily from surgery. So I think some people will sample, but I have to say I've also heard from many people, including many doctors, who have read it cover to cover.
Yeah, I know as a general internist, I loved reading it cover to cover because there's just so much wisdom in that. But I think you highlight these teachable moments where maybe somebody's having symptoms that they're struggling with, or a new health condition they've not really been able to make progress with or hadn't had to think about before, or a cancer diagnosis or a surgical procedure where you start to really think about, how do I optimize my health and then recover most quickly? So I think it will be useful for so many people. Let's talk about what integrative medicine even is. I just came from the clinic, and my last patient said to me, I have seen so many doctors. What exactly is it that you do? So when people ask you that question, how do you define integrative medicine?
I wish we had a really pithy definition, but we don't. I say integrative medicine is a larger paradigm of medicine, and we absolutely value and use conventional medicine, but we also recognize the large extent to which lifestyle, leads to many of the diseases that ail people today. So we have a huge focus on lifestyle. That includes what we eat, how much sleep we get, how well we move, the quality of our relationships, our spiritual lives, the toxic chemicals we may be exposed to. So all of that is part of lifestyle. And then we integrate, there's that word, things that come from other systems of medicine. For example, what would a traditional Chinese medicine practitioner say? What would Ayurveda have to do in this particular situation? What about people who come from Native American traditions or Western herbalism? And so we have a much, much larger toolkit. And the other thing I love about integrative medicine is it's relationship centered. So we're asking people, well, what's your preference? Do you have an intuition about what you need to do to heal or get well? And the last thing I'll say is that in medicine in general, it can take up to 18 years for an innovation, something that has been proven in a research study, to be integrated, that word again, into medical practice. And in integrative medicine, we believe that's just too long. So we were very quick to say, well, what about the microbiome with this growing body of research data? What about red light therapy? What about psychedelics, which is quite early still? So we're looking also into the future, not just at the past. That's a long definition. What do you tell people?
I agree that it is such a difficult field to encapsulate because I love Dr. Weil will say it's just good medicine.
Yes.
But I do talk about the focus on health and healing as opposed to the disease paradigm, disease detection, diagnosis, and treatment, and really trying to see how to support health almost regardless of the burden of disease. So some people have a high burden of disease and continue to be very, very healthy, and others have a low burden of disease, meaning they don't have very many diagnoses, but they're very unhealthy. And we can use our broad toolbox to enhance that. No matter where that person fits on that continuum. I loved in your book, you said that you're challenging your readers to be curious about our body's incredible ability to heal, because you said this as part of your definition. There is this innate ability for the body to know what it needs if we get out of the way or make space for some of those things to happen. Do you agree?
Yes. Early on, we were working then we were a small program in integrative medicine. Now we're a center of excellence at the university, but we were working on the definition, and it started with healing-oriented medicine that takes account of the whole person, body, mind, and spirit. Now, that healing-oriented medicine was quite intentional because it did honor the innate capacity of the human organism to heal. And I think this is something that's really underappreciated or undervalued. And part of it is the success of conventional medicine, where we do have amazing treatments, amazing surgery, huge advances, but all of those things are working in conjunction with the healing systems of the body. So, a really simple example is, say somebody has a terrible infection and you give them an antibiotic and they get better. That's awesome. And we might be tempted to say, well, it was that antibiotic that cured the person. That's not actually true. It's the antibiotic lowered the overall bacterial load that the person had to deal with. And then the immune system of that individual was able to appropriately respond and recover from that infectious illness. It's not just semantics. There's a lot to our bodies having this capacity and wanting to work together to augment, to do everything we can to remove impediments from healing, but recognizing that fundamentally healing is intrinsic. It's something our body knows how to do.
And bigger than that direct action, right? If you fall down and break your arm and you're in an area where you're well supported, able to access care, get the things that you need, you're going to recover differently than that same fracture in your arm happening at a time where your support isn't as good, your stress is higher, your diet is maybe not as good. So I love that concept of the interplay for even something as objectively simple as the same fracture in a bone. Let's talk about a very specific health time for women, which is something we've talked about on Read Talk Grow many times, and that's menopause. We started the conversation about menopause with episode 12, and the novel there was called The Change. But you have a chapter called Mastering Menopause. And one thing I want to highlight for our listeners is that you actually start by talking about hormone therapy, which many people would consider a pharmaceutical approach. So it's a prescription medication. Do you think people are surprised that as an integrative physician, maybe one of the first things you're going to recommend is this prescription?
People are surprised, yes. And this is, again, that thoughtful integration where we don't throw out prescription medicines. We don't always start with a supplement or with acupuncture or whatever. We're really assessing what's the evidence. So for menopause, the most effective treatment we have for menopausal symptoms is hormone therapy. That doesn't mean everyone needs it. It doesn't mean everyone should take it, but it is the most effective therapy. And the important thing to be aware of in 2026 is that we are not just recommending hormone therapy for symptom management, because there are other ways to manage symptoms. We are recommending it often as a strategy for preventive health. Women who start hormone therapy at the time of menopause, as you know, have a significantly lower risk of dying of all causes. So that's true preventive medicine. They have a lower risk if they start the hormone therapy within 5 years of menopause, or if they have a surgical menopause, they have their ovaries out, then they have a lower risk of cognitive impairment. Nobody wants that. So we have this unique opportunity at the time of menopause, not just to manage symptoms more effectively, but also to prevent illnesses. We also know that hormone therapy reduces the risk of osteoporosis. It reduces the risk of colon cancer. It actually reduces the risk of diabetes. So there's a lot to talk about there when we're talking about risks and benefits of medication. And I think hormone therapy got such a bad rap for such a long time because of the results of a flawed trial, the Women's Health Initiative, that people are still reluctant, or they might say, but my menopause isn't especially bad. And that's awesome. And they may decide that for them, because this is a personal decision, it's not that worthwhile. But I also see a lot of women who are upset and frustrated that they missed the window because they were told by their doctors, you don't have bad symptoms, you don't need it. And yet perhaps they have a family history of heart disease, or they have a family history of Alzheimer's. And now they're frustrated that they weren't given the opportunity to reduce their risk by using hormone therapy.
Wow, I love how you've said that. And just to highlight for our readers, you were talking about cognitive functions. So, really looking at future memory issues and even dementia, particularly in women who go through an early menopause, and then women who go through an abrupt menopause, like a surgical menopause or a menopause that's happened from a medication, like during chemotherapy. We see this when it happens very quickly, that tends to be highly symptomatic and should be at least considered for treatment. So in the book, you list that women are a good candidate for hormone therapy if they have bothersome hot flashes and other symptoms, concerns about bone health. So you mentioned preventing osteoporosis, have recently become perimenopausal or menopausal. So that timing hypothesis within that 5 years. But there are some women who just aren't candidates for hormone therapy. And will you remind our listeners what those are?
Yes, so we don't recommend hormone therapy to women who have had any kind of hormonally driven cancer. That's breast cancer, endometrial cancer, ovarian cancer. We also don't recommend it to women who already have heart disease or have had a stroke. We also don't recommend hormone therapy for women who have had blood clots, who have active liver disease. And you mentioned that timing hypothesis. So in general, we want women to start hormones within 10 years of menopause or before the age of 60. We certainly don't recommend hormones after age 65. And so all of these things are things to consider when somebody is talking to their doctor about the pros and cons of hormone therapy. The other interesting thing is that menopause, essentially midlife, is a good time to take stock and think about preventive health. We have a lot of poor health in our country. We have a lot of people who wrestle with metabolic issues that can range from being insulin resistant, having diabetes, being overweight, having early heart disease or signs or biomarkers of heart disease. And so it's really a good time to be thinking about what are the steps that I could take to live a long and healthy life.
Yeah, I love that. And I want to talk about some components, but I'll just put in a plug for my women's health center where I work at Mayo Clinic and other certified menopause experts. In that long list that Dr. Maizes just gave, there might be some subtleties. So if you are somebody who has, for example, ovarian cancer, or you are at high risk for breast cancer but didn't have breast cancer, or you had a blood clot that happened during surgery because it was provoked by the surgery and you recovered, you very well still may be a candidate for hormone therapy. So please talk to a certified menopause expert if you find yourself in one of those areas that needs to be considered in greater detail. Okay, so Victoria, tell us, does diet matter in menopause? Is there a manipulation of the diet that women could do to feel better?
Yes. So two ways of answering, because we've been talking about these sort of two streams. One is for symptoms. And so we do know that a Mediterranean diet or a diet that's high in fruit is associated with significantly less hot flashes. Mediterranean diet also reduces the risk of heart disease, of depression, of infertility, if that is still an issue for women, of certain kinds of inflammatory conditions. So it's absolutely a good way to go. And it's yummy. That's the other thing that's good about it. It's not a diet that'll make you feel deprived. The other things to think about: metabolic health. So are you eating an anti-inflammatory diet? Is there anything that you might want to experiment with in terms of elimination, where there's something that may not be true for the general public, but for you is pro-inflammatory? For some people, that's gluten. It could be eggs. There's a variety of things that can be pro-inflammatory: dairy, citrus. It doesn't mean everyone has that reaction. It's a little bit idiosyncratic, but we sometimes do elimination diets to see. Soy foods are really helpful during the menopausal transition, both because there's some evidence that whole soy foods, which is not like the packaged fake cheese or fake hot dogs, but more tofu, tempeh, edamame, maybe soy milk, soy nuts, but those can reduce hot flashes. And also they help reduce bone loss during that menopausal transition. And so those can be really helpful as well. I always worry a little bit about environmental chemicals. Some of them can be what we call endocrine disruptors, which mean they disrupt normal hormones. And so I like people to think about organic food. I like them to minimize their exposure to plastics, microplastics, which can affect hormones at times. And I like especially the animals that are grown with hormones. For example, beef, cattle are grown with these pro-inflammatory, pro-growth kind of hormones for women to avoid that as well.
Hey listeners, we hope you're enjoying this episode of Read, Talk, Grow. If you find our discussions helpful and insightful, please take a moment to subscribe to and rate Read, Talk, Grow on your preferred podcast platform. And don't forget to tell your friends to listen. Your support will help us reach more readers and those eager to learn about health through books. As always, feel free to drop us a line at readtalkgrow@mayo.edu with suggestions for books, topics, or any comments. Thanks for listening.
I just want to highlight the elimination diet because this is a strategy that comes up in several of your chapters. And for listeners who are interested, you have a couple of appendices at the end of the book, one of which is your rapid recovery toolkit. And you go through the elimination diet, some of the highly suspicious foods, ways to do that, and then ways to reintroduce those into your diet, because one important component of the elimination diet is not just taking it out and seeing if you feel better, but then maybe adding it back to see, is there a dose of that at which you start to provoke your symptoms again, or maybe notice it didn't matter at all. Am I encapsulating the elimination diet well enough?
Yes, I think you are. The only thing I'd say is in some things, like for example, if you have a diagnosis of celiac disease, we wouldn't have you retest with gluten. But broadly speaking, what we don't want is for people to eliminate so many foods that they end up on a really shrunken number or list of things that they feel like they can eat. And that has its own health challenges.
Yeah, thank you for that. Yeah, definitely a distinction between bringing a food out of your diet to see if your symptoms respond versus having a medical diagnosis where you have a sensitivity to that, such that somebody has told you you have to absolutely continue to avoid that. And before we leave menopause, other thoughts about strategies like acupuncture or using exercise to manage symptoms?
There are so many other things that can be done to manage symptoms. So there's very good evidence for acupuncture and also for Chinese herbal medicine, because there are a number of those herbs that can manage hot flash symptoms. There are strategies like having a cooling device for your neck or a cooling mattress now that have been studied and shown to be effective. Paced respiration, which is when you're going to count your breath. You're going to breathe in slowly from your nose. You're going to purse your lips and have your out breath go through your mouth, and the exhalation will be longer than the inhalation. That has been shown to be helpful. And then there are a number of dietary supplements that I find can be really helpful as well. They range from things like black cohosh, which can help hot flashes, St. John's wort, hot flashes, and also sometimes the mood disturbance. That's a really lovely herbal medicine, unless you're on any medications, in which case it interacts with so many things that you got to be really careful and ask your pharmacist or your doctor to be sure that that's okay. If your main issue is sleep, then there are supplements we might recommend to help with your sleep. If your main issue is irritability, there are supplements there. So just for people to know that if they can't take hormones, they prefer not to take hormones, there's still a really big tool bag of other things that can be used.
Yeah, I love how you said that because I don't think I've ever seen a woman come in with symptomatic menopause and she's like, I have hot flashes and only hot flashes.
Right.
They all have something else, whether it's the joints, the sleep, the mood, the weight management, all of that. So it's why it's so important to have a deep toolbox. If it's okay, let's switch to talking about breast cancer. So you include breast cancer in your third component of this book, which is about recovering from surgery. So you put it together with recovering from breast cancer surgery. And one strategy that readers navigating breast cancer have potentially not considered is doing a form of a healing ceremony around their treatment. What is that?
Yeah. Well, I think for anybody, man or woman, hearing those three words, you have cancer, is so shocking. And then what usually transpires is you feel like you've turned your life over to a set of doctors who are putting together a treatment plan for breast cancer that almost always includes surgery, which is why it's in the surgery section, but chemotherapy, radiation therapy, hormonal therapy, immune therapy. The good news is there are many strategies. The challenge is sometimes you need several of these when you're being treated. And it is really wonderful. And this is one thing that integrative medicine shines at is, okay, I'm going to have those treatments. I'm going to follow the conventional plan because that has the best chance of making me go into remission or curing my cancer. but what else can I do? What is in my hands to do? And in integrative medicine, there are many things ranging from the diet you eat to physical activity to breath work to having other kinds of therapies like acupuncture. And so ceremony is, I think, one way of pulling back some of the sense of control, one way of achieving some comfort as you go through this. And we have a colleague in common, Dr. Anne-Marie Chiasson, who teaches a lot about ceremony. She often says it's got to have a beginning, a middle, and an end. In other words, it doesn't have to be super complicated. So I have had people in my practice who have a breast cancer diagnosis and they develop a ceremony. It could be, I've had people who get all dressed up when they go to chemo and they go with their friends and they turn it into a party. I have people who pray over the infusion bags that are filled with chemotherapy to turn that from something that some people call a poison into a sacrament. I've had women who, when they lose their hair because of a side effect from chemotherapy, they've tattooed this beautiful flowering vine over their scalp, or if they have a mastectomy over their chest. And so it's this way of reclaiming ownership of your body and to some extent of the overall experience.
Yeah, and it's so important when you end up in this new world of cancer treatment that you are marking it as having this beginning and then not having that be what defines you as it comes to closure. You mentioned diet, and would you say the diet is basically a similar overlap to what we heard about with the menopause transition?
Yes, I do think that there are some differences. Soy food is still a good idea. That often surprises people because they've heard that soy has plant estrogens. But the research we have shows that it actually reduces the risk of recurrence of a breast cancer. This is on women who are on tamoxifen, but in other women as well. It's most strong of a reduction if you're on that medicine, tamoxifen. So I do recommend that soy foods be part of the diet. Green tea is something that has been shown to enhance survival in women who have early diagnoses of breast cancer, early stages. Alcohol, I do recommend that women avoid alcohol if they've had a breast cancer diagnosis because there is this provocation of cancer. There's a linear relationship. The more alcohol you drink, the higher your risk. And so that's a bit different. I do think organic becomes even more important because your body has shown itself able to form a cancer. And so avoiding those endocrine disrupting hormones that are in non-organic food because of the pesticides or the hormone residues, I think is even more important. So broadly, it's the same, but I think there's some more specificity that's unique to breast cancer. The other thing I'll say that most people don't know is that there is evidence that if you do a longer overnight fast, this is what we call time restricted eating. So 13 hours. Now that sounds like torture, right? But it turns out it's just not so bad. Say you stop eating at 7 in the evening. That means you don't have any calories until 8. You could have tea, you could have black coffee. You're just not going to put milk or sugar or honey in them. And then at 8 o'clock, you could go and enjoy your breakfast. But that longer overnight fast reduces the risk of recurrence. And, these are some examples of why I wrote the book. I want people to know this. And these are not broadly known facts, and breast cancer is common.
Yeah, really, really common. And I don't know if you said, but I'll just double down on the Mediterranean diet in breast cancer with history or risk. You really want to eat in that pattern, which is lots and lots of plants. And maybe would you distinguish between green tea as a supplement versus a bottled drink I buy at the gas station versus a cup that I brew at home?
Yeah, ideally, you are going to stick with tea bags or a loose leaf tea that you put in your own little filter. And that's for several reasons. One, organic is advised for tea because it turns out tea is one of the more polluted things in the way it's grown with pesticides. So organic is your way to minimize that. In terms of an iced tea you might buy at the store, almost all of them are sweetened. And one of the things you don't want when you have breast cancer is you don't want to have those spikes of blood sugar because those turn out to be pro-inflammatory and also probably for most women pro-cancer growth, that bump in blood sugar. So that's a problem there. And then the supplements I don't recommend, in part because there's been some risk of liver disease seen with green tea supplements. And so why not do it as a food? We talked earlier about ceremony. I'll just mention ritual. Ritual is usually a smaller act or a part of a ceremony. Well, for a lot of people, making their own brew in the morning, whether that's a cup of coffee, which also has a lot of health protective effects, or brewing a cup of green tea, can become this little ritual. And once again, it's a ritual of you investing in your own health and well-being.
And even when you frame it as a ritual, it doesn't necessarily mean that it has to be a big deal once you get that rhythm of it. If you have a way to brew your tea and you have the dried tea leaves, it only takes a few minutes. So I really try to urge people to find space to do that. What about breast cancer and exercise? Is that really important?
Yes. First, I'll just say exercise is good for everything. If we have one panacea that we can speak to, it's exercise. It's just like it's good for our hearts, it's good for our mood, but it's also good for preventing recurrence of cancer. And, we used to have people go to bed when something had happened to them. I mean, I remember my grandmother telling me she was put to bed for 2 weeks after childbirth. That was standard of care at the time. You can have a hip surgery and you're out of bed that same day. We no longer put people to bed rest because we know that if you're put to rest, you have a higher risk of a blood clot. You end up losing muscle and bone, both of which are really important to our health. And so in breast cancer in particular, there is evidence that exercises reduces the risk of recurrence and is associated with longer survival and even walking. I mean, we're not talking about it having to be, running or weightlifting. I mean, all those things may be good for you, but simple walking has that effect.
And on some of your social media accounts, you have a thread where you say, "What did you see on your walk today?" And I think of you often, especially in these spring months where the flowers are blooming and the ducks and ducklings are out. I've already said I think there's so much wisdom in this book, but I also think it's quite a brave book. And in this chapter, you talk about a topic that comes up really way too infrequently, and that's sexual health. Why is that in the breast cancer chapter?
So this is a little like exercise. Having a sex life, good sexual health is good for all of us. It has really wonderful associations with better heart health, better longevity, better relationships. It's good for us. But women who've had breast cancer often take a real hit to their libido. 75% of women will say that they have diminished libido. And that could be a direct effect of some of the hormone therapies they're on, which block estrogen. It can be a change in body image, somebody having a breast removed. It can be fatigue from some of the treatments. It can be relationship issues. Sometimes your partner may not be comfortable touching your breast anymore after it's been treated. There's an increased risk of vaginal dryness, which can be associated with pain with sexual intercourse. And none of us got trained. I don't know how much training you had in your medical school residency about talking about sex. I had very little. But when I came to integrative medicine, because I was the only woman in my cohort, all the women with breast cancer came to see me. And so I began to ask about their sexual health. And then I taught at this retreat for women who had any kind of cancer. And I ended up leading a workshop about sexual health. And I learned so much from these women, about things they had done that were helpful, or things they had done that hadn't worked, and things they wished their doctor had talked about. And so I hope that listeners will take courage and ask. And if your doctor doesn't know the answer, you could ask for a referral. There are people who specialize in sexual health. Sometimes it's an OBGYN, sometimes it's a urologist, sometimes it's a sex therapist, but there are people who will have answers for you.
Yeah, it's some really phenomenal resources and books, things like that out there as well. So I love that point about bringing it up and seeking resources and not waiting for your treating team to bring it up, because I think often it just doesn't come to the top of the priority list, but it very well might for the woman herself. Before we finish up, are there any other strategies, modalities, treatment in integrative medicine that you really wanted to highlight on today's show?
Do you have another hour or two? I mean, there's so many things that you and I could talk about and that we do bring to our treatment and to our office. I guess the thing I'd like to leave your listeners with is just this sense of agency, that there really is very large number of things that you might be able to do. And if treatment A doesn't work, there may be a treatment B, C, D, E, F. There may be another doctor who has other strategies. There may be an emerging treatment that someone at a specialized center knows of that isn't broadly known. So I just really want to encourage that your listeners know that there are many, many ways in which either an integrative medicine doctor or somebody else, maybe it's someone trained in traditional Chinese medicine, maybe it's someone completely outside of the field of medicine who has an expertise that would help you. So keep looking, keep turning over those stones to find the thing that helps you to heal.
Thank you so much. There just is so much in what we've talked about in this short time. And for listeners who haven't read the book yet, there's even more in all of these chapters. So I highly encourage you to go out, buy a copy, and read Heal Faster, Unlock Your Body's Rapid Recovery Reflex by Dr. Victoria Maizes. Victoria, thank you for being here with me on the show.
It was such a pleasure. Thank you.
Read Talk Grow is a product of the Women's Health Center at Mayo Clinic. This episode was made possible by the generous support of Ken Stevens. Our producer is Lisa Speckhard-Pask, and our recording engineer is Rick Andreessen. Visit our show notes to see the books discussed today and for links to other health education materials. Follow us on social media like Instagram and Facebook, or reach out directly to our email, readtalkgrow@mayo.edu, with suggestions for books or topic ideas. We'd love to hear from you. This podcast is for informational purposes only and is not designed to replace a physician's medical assessment and judgment. Information presented should not be relied on as medical advice. Please contact a healthcare professional for medical assistance if needed for questions pertaining to your own health. Keep reading, everyone.